stars 15 young campaigners who've experienced mental health problems across global regions for their vision for mental health and well-being in 25 years' time. Here is what they said.
I envision that by 2050, the world has significantly changed. Talking about mental health will be something as simple as talking about the weather, where mental health, especially in South Asian countries, would be something that's not swept under a rug.
Where you can talk to your mates, talk about your mental health just as frequently as you talk about how your favourite sporting team is doing.
And people who live with mental health challenges or have experienced mental health challenges wouldn't be defined purely by those experiences or diagnoses or stereotypes about those experiences, and instead would be valued for their insight, their strength, and what they're bringing to the table.
In this world, there will be no waiting for people to break down, but rather, mental health services will be proactive, preventive, and embedded in empathy.
I hope that mental health services are more accessible to everyone, regardless of their income or identity.
There's a focus on human rights, housing, access to healthcare, racism, transphobia.
Youth-specific services, I think, should be a priority. And overall, I would say that we need to dismantle the systematic barriers that Māori and Pacifica, other marginalised communities, still face when accessing care.
I want us to go beyond awareness to inclusion, implement laws that protect people with psychosocial disabilities from discrimination.
As a society, I would love to see us overcoming the stigma, specifically around men's mental health. I've lost my own father to mental health.
Having people who have dealt with lived experiences of mental health in policy making and in the media would have a positive impact on society.
You know, I'd love to look to a society where we get kind of 10 to 12 sessions a year. We're able to see a psychologist monthly, even when we're doing well. I think that preventative portion of mental health support is overlooked.
We often see a lot of different things addressed in politics, like homelessness or poverty or abortion, but we never see specifically mental health being addressed, which is pretty unbelievable to me, because I think mental health is everything.
In 2050, I hope mental health care is encouraged to be treated more like tuning an instrument. Not a last-minute fix before everything snaps, but a daily habit to take care of yourself.
Caring for our mental health will be as a routine as brushing our teeth.
Mental and psychological well-being should be embedded into the curriculum by 2050. I remember one class only on mental health concerns whilst in high school. No one visited my school with lived experience. Why not?
As much as we can add 2 + 2 together, I hope that we can understand the importance of sleep and exercise and social connection and nutrition and the impact it has on our mental health.
Parent programs, because sometimes it's not always the kid. It could be the parent as well.
I think we should look towards a social, trauma-informed and environmental way of looking at mental health. For example, when a flower doesn't bloom, we don't look to fix the flower, we look to fix the environment, and it's the same for people.
I think that we need to normalize that being a human can be hard, and that life will hurt sometimes.
I'd like the workforce to be well looked after, so more support for the front line.
I'd also like better antipsychotics.
When I get older, I would love to see a more digital or in-person support when it comes to the availability of therapists, and put them in everyday spaces, whether that's your job, whether that's education, whether that's gym, whether that's at the library.
In Ghana, we are a faith-based country. I wish that in the future, there will be an effective collaboration between faith-based organizations and mental health professionals.
I would want services that are proactive instead of reactive, face-to-face support, peer support, people that get it, mental health care that's stigma-free, mental health care that treats me as a human first, and a diagnosis if that's still been second.
I believe that having the best of both worlds, AI and human connection. If you needed mental health care at 2 a.m., or if you needed to have a chat with a therapist on a Wednesday afternoon.
I have a lot of clients that already sought guidance through ChatGPT and some of these AI chatbots, which has helped them. But having, a mental health professionals guide kind of the information that is shared through these services, I think is going to be so important.
I wouldn't want to talk to a chatbot or an AI therapist. I want to look someone in the eyes and feel like they understand. Not because they're programmed to, but because they've actually lived through it. Because in the end, healing doesn't come from perfect algorithms.
I would want them to grow in a world where getting mental health support is safe, stigma-free, youth-friendly, and as normal as asking for help with homework.
The future that I want for our tamariki or young people is when they go into services, if that's a path they need to take, those services see their whole selves, the whole different intersecting parts of their identity, not just one part or just their symptoms.
I'd like them to experience unconditional positive regard, support at their fingertips, and no 3-month waits.
A lot of humans are kind of just programmed to compare themselves to each other. That's the big problem with social media. But let's take that factor of comparing each other and use it for good. So you compare yourself to someone that has also struggled and say, okay, well, if they can do it, so can I.
By 2050, getting mental health help should be simple, inclusive, and fair. No matter who you are or where you come from.
We should also get around Indigenous mental health professionals like Dr. Tracy Westerman, who's not only supporting Indigenous peoples through her scholarship program, but she's doing great research.
I want it to be a focus on peace support because you can get things from communication, creativity, compassion that you just can't get on a prescription. I would like the government to invest more into mental health. If it even means creating a Ministry of Mental Health in Ghana, it will go a long way to increase the GDP of our economy.
The gift of mental health support and the care and a warm connection and community support should be passed on to the future generations. It shouldn't get harder for them. It shouldn't be something that they have to struggle through or feel ashamed for, when our societies can do so much better for everyone.